Okay, so let me go ahead and start this with the presenter view. Here we go. Okay, so my name is Shelly Roan. I decided to do this on diabetes. Um, let's see, let's go ahead and start. So the causative factors, for the purposes of this presentation, I divided it between type 1 and type 2 diabetes. Causes for type 1 diabetes, the immune system basically attacks and destroys the insulin producing beta cells of the pancreas. You also have genetic and environmental factors like a virus that could trigger the disease, um, and things like that. Causative factors for type 2 diabetes. This is more of a developed disease. You have a lack of physical activity, obesity, or being overweight. Having extra weight can cause insulin resistance. So, being overweight, you see one of its insulin resistance, but it's also the fat storage location. It's where you're storing this fat. And we see a lot of diabetes cases when you have excess belly fat. There's a start of type 2 diabetes with insulin resistance. So basically, the muscle and the liver and fat cells don't use insulin well enough, so the body will need more to break down glucose, as well as type 1 diabetes. In type 2, you see a association with genetic factors, family history, other instances such as genetic mutations, hormonal disease, damage or removal of the pancreas, and medicines being taken as well. First risk factor that I looked at studied a group of Turanian adults 20 years and older. The PARs adjusted for family history of diabetes, age, and triglycerides. The systolic blood pressure was, as noted for the population attributable rate, 23.3% of these subjects were overweight. 37.1% of them were obese. So out of these 4,728 subjects, 3.8 of them developed type 2 diabetes. And then the rate of the population attributable rate is 23% overweight and 37.1% obese. Very large amount of that coming from just the simple factor of being heavy, of being overweight and being obese. The second and third risk factors that I looked at were alcohol consumption and physical inactivity, I should say. This was to come from a study about an association with Chinese adults, looking at 461,211 subjects, 30 to 79 years old. Out of those, 8,784 were diagnosed with type 2 diabetes. Of those people, the alcohol consumption accounted for a PAR rate of 21.5%, and a physical inactivity accounted for a PAR rate of 12.2%. So you're really seeing a large association between the alcohol consumption and physical activity, not as much as weight per se, if you were to compare the two studies, but a large enough amount that you can definitely see the relationship between the alcohol consumption and the amount of physical activity on diabetes. The fourth risk factor that I looked at was depression. So in this study, there were 3,521 subjects, 55 years and older. The cases of depression were diagnosed according to standardized criteria. Diabetes was assessed using risk factors and using risk factor questionnaires. 379 of them were identified with depression. So you're comparing depressed and non-depressed subjects. The PAR rate was 6.87, being the rate of diabetes attributable to depression, and then clinically significant depression associated with a 65% increased risk factor for diabetes. So this was interesting for me because it kind of looked at the fact that diabetes doesn't necessarily cause depression. It is very well the other way around in some instances, whereas depression can lead to a diagnosis, a 65% increase of a diagnosis of having diabetes. Last risk factor that I looked at was disability. So the study found 22,878 subjects along a period of 12 years. These are individuals 51 years and older. So for people that had severe disability, they found a 63% higher risk for diabetes. 41% of them had some level of disability at the baseline. 35.7% of them developed disabilities during the study, and 15.5% of them developed diabetes. So there's a statistically significant dose-response relationship of increased risk of diabetes among those with any level of functional decline. The incident disability I only found the population attributable fraction, which was 6.9%, assessing the percentage of diabetes case attributable to mobility disability. Couple of programs that I looked at based on what kind of stood out to me as risk factors. One was the American Public Health Association, or APHA, which says it aims to advocate for national policies that address the prevention of obesity and racial and ethnic disparities in health status. So obesity is a large factor in the risk for diabetes. It's linked to food security and access to healthy foods. So this is going to be influenced by federal subsidy policies, meaning a change in these policies could potentially mitigate rising chronic disease rates. The next one that I looked at was the CDC, the Healthy Aging Program. This looks at integrating mental health and public health together because this idea of depression causing diabetes was really intriguing to me. So it links these medical participants who have diabetes or congestive heart failure as well as depression. And basically, it links the two of them, and it's found that people that have the diabetes and congestive heart failure, as well as depression, have a significantly higher healthcare cost than anyone that does not have a coexisting depression. So the link between the treated depression and diabetes could really help us understand this factor and lower healthcare costs and maybe start preventative measures in the future. So that was my presentation. Here are my list of references, and thank you so much for watching.